This video is about brain damage and language deficits. Speech and language abnormality among brain injury patients are common. These disorders differ based on the characteristics. So aphasia is a language disorder caused by damage in the specific area of the brain that controls language expression and comprehension. So aphasia leaves a person unable to communicate effectively with others. In simpler words, problem speaking or understanding what other people say can be called as aphasia. So there are multiple types of aphasias and aphasia-like conditions. Although the symptoms of aphasia have many similarities, important differences still exist. So we will be discussing about that. So there are 8 main types of aphasia, and experts consider 3 main factors when determining which kind a person has. So those factors can be the fluency, understanding, and repetition. So what is fluency? The fluency can be like, do they speak smoothly and easily? Does their speech have the right pace, pitch, pronunciation, and grammar? Can they also write without difficulty? And in understanding, does the person understand what other people are saying? Do they say phrases and sentences that make sense? Can they also read and understand written words? And in repetition, does the person have any trouble repeating the words, phrases, or complete sentences? So they have mentioned like there are main 8 types of aphasia. So as it is listed here, you can see it is Broca's aphasia, Wernicke's aphasia, global aphasia, transcortical motor aphasia, and sensory aphasia, conduction aphasia, and mixed transcortical and anomic aphasia. These are the main 8 types of aphasias that we can see. So in order to understand how aphasia works, it's better if we know about 2 main parts of brain, so which works together when we speak. So those areas are namely Broca's areas and Wernicke's area. So Broca's area, the part of brain, is named after the French physician who discovered it, that it controls the muscles you use to talk. And it is part of your frontal lobe. Broca's area is part of the frontal lobe. The next one is Wernicke's area. So Wernicke's area, the part of brain which got its name from a German neurologist who discovered that it controls your ability to understand and select the right words to use when you talk. And it's the part of your temporal lobe. When the Broca's area is part of frontal lobe, the Wernicke's area is part of temporal lobe. So here you can see the picture of it. So in this video that we are going to discuss about 2 types of aphasia, the Broca's aphasia and Wernicke's aphasia, the damage in the frontal lobe and the damage in the temporal lobe. So let us start with Broca's aphasia, which has many other names like anterior aphasia, non-fluent aphasia, expressive aphasia, and agrammatic aphasia. So what are the characteristics? So this, as we know, it is Broca's aphasia, that means damage in the area, that is Broca's area. And what are the characteristics of it? Disrupt the ability to speak. They'll be having slow and non-fluent speech. They mispronounce mostly, but they manage that usually with the meaningful words. So here, the posterior parietal lobe has something to say, but damage to the frontal lobe makes it difficult to express. So here you can see the pictures. The highlighted one are the Broca's area, and the next picture, which is where the Broca's area is damaged. And the other characteristics, if we see, there are difficult with words having grammatical meaning and mostly use content words. So here we can see the less functional words and more content words. Here, there is an example. So you can read. Okay, try to read that with the pause. Right. Here, you get that. So here, when we are checking with the characteristics that we have discussed and the example, you can see the functional words are missing. The functional words are the grammatic verbs, that helping verbs. Helping verbs are missing here. But when we see the content words are there. And with the help of this content words, they're trying to communicate meaningfully. It is non-fluent, but there is a meaningful communication. So if we look into the characteristics that we have discussed, so in Broca's area damage, the speech output of this patient is slow and effortful, and it lacks functional words, and it resembles a telegram. It resembles a telegram. And Broca's aphasia also may have accompanying problems with speech articulation because of deficits in the regulation of the articulatory apparatus or muscles of the tongue. Finally, these patients sometimes have a hard time understanding reversible sentences, or which can be even called as agrammatism. So, agrammatism, comprehension deficits related to syntax, difficulty in grammatical construction. So, here I have two examples like the boy kicked the girl and the boy was kicked by the girl. So, these are the two sentences. So, here when it comes to the people with Broca's aphasia, they'll be having the problem to understand the second sentence, that is, the boy was kicked by the girl. And there are other characteristics of anomia where word finding difficulties that they experience, articulation difficulties that they, and these are the other characteristics that we can see when it comes to a Broca's patient. So the next one is Wernicke's aphasia. So in Broca's area, we discussed that damage will be to the Broca's area. In Wernicke's aphasia, the damage to Wernicke's area. Here, poor speech comprehension, meaningless speech, it is fluent and unlabored speech. Prosody is maintained. And the use of functional words are very good, but very few content words. So here, there is a example. The examiner is asking a question and try to read the answer being given by the patient. So here, at a glance, we feels like it's a paragraph, but as we read, we understand the functional words, the helping verbs and other things have been used more, and it's used properly. But when it comes to the content words, there we can see there are no content words, or that does not make sense when we are comparing that with the question being asked to them. So there are other characteristics that we can see that generally are unaware of the deficit, and lesion or damage leads to disruption in recognizing the words, spoken words, comprehending the meaning of word, and ability to convert thoughts into words. So those can be named as pure word deafness, transcortical sensory aphasia, and the secondary damages due to tissue swelling in the surrounding regions contributes to the most severe problems too. So here, a pictorial representation of it where Broca's area, they can see the Broca's area and the Wernicke's area, and the Broca's and Wernicke's area is connected, how it is connected. So all these explanation will be part of other types of aphasias that we will discuss in the next video.